Hey, Sebastian, can I ask you a question about that
Sure.
without,
Yeah.
I don't, we don't have to have you repeat it.
Mary, you got your hand up.
Oh, sorry, Mary. Sorry, Mary. Mary.
No, that's fine. I was just going to say I've just read that list again for about the third time this week, and I've just noticed that there's only one that I haven't experienced, and that would be the desire for alternatives such as self-management options not offered, simply because I didn't know such a thing existed. But back when I first started, I would have experienced every one of those.
Mm.
So it's a big problem.
Mm.
And I'm with you on the private clinics versus the others, Seb, too. I know exactly what you're saying there. Yeah.
I, y- y- I'm going to chime in again because I don't even think what I speak of is far enough up, right? So I'm just talking about people coming into the system, right?
Mhm.
So I'm saying, look, can we grab people earlier, right? Because we all know what happens in the example you gave, Sebastian. I mean, that's here a lot. And you know what happens in our, this is the other thing I want to say. I'm really trying to get my head out of trying to solve the problems in the current system. It's not going to solve these problems. So, yet if I look at the current system, it is made to weed out a lot of those people. So they just have to keep waiting, keep waiting, keep waiting, Sebastian, right? Um, and then what do? The people run the clinics go, oh, I don't want to work with those people. They're trouble. And I'm like, wait a minute, what's that mean, right? No, they've just been right. They've been looking for a solution, and
Yeah.
it's really sad sometimes because right, I listen to these calls, I listen to the calls, and I listen to the owners of practices and within the system saying, well, we schedule these people differently, or we approach them differently, or we plan on them not showing up. I'm like, wow, that is not a way to run a healthcare practice, right? Yeah, and I'm talking about the states. I'll just and so
Wow.
how do we even get this? Here we go. And I think this is where this group has been anyway. How do we get the information out to the masses? So by the time they come in or want to enter the system, shall we say, I don't want to say they're wiser about it, but they have some expectations, right? And, and the example I gave is only as good as the information that comes in, right? Because if we're building up tools to try to screen people, it's only as good as the current
Mm.
information that's
Mm.
in that system, also, right? Which can be very biased, as we all know. Yeah, I run into this a lot, and I always challenge my colleagues when you see these research studies come about people who cancel appointments, don't show up for appointments. I'm like, it's just making
Yeah.
people go, good, we won't schedule them. And I'm like, no, that's not the problem to be solved here, right? I
Mm.
think that's what I heard part of. That was my takeaway from what you said, Sebastian.
Yeah.
Does anyone have any thoughts on that? It does seem to be a systemic issue with people who are desperate for help because of pain, and yet they don't turn up for appointments. It seems to go right through from pain clinics to private practice and even our support groups. We get the same. I've got someone who's mad keen to come along. They'll join. Oh, yes, look, I'll see you on Thursday. You never see them. And the same thing is happening with the pain clinics. And does anyone have any thoughts on that?
I the only thing, and I guess this, I'm maybe just answering your question with a question, is like part of it is what like when I see people and like I look at their face and I can like see the stress. I'm like if I was in as much pain as I think you're in, I don't think I'd leave the house. That's what crosses my mind. You
Yeah,
see people they're in that state. And I'm like, I wonder maybe if that's the case, because we've like the people, there's so much pain and they're in that like really acute mode, and they like just getting into their car is really hard. And I'm like, maybe in those cases, does virtual care eliminate that barrier? Like, more of a question. I don't know because I don't really do virtual care. It's something I'd like to get into more. So part of why I'm asking that too is if
To do
maybe
the
that's it.
appointment via like
Yeah, yeah. Like
yeah,
if they're like, look, there's no way I can sit in my car for 20 minutes and drive to your office. Like I
yeah.
can't, right? Then okay, maybe you can
yeah.
turn on a Zoom call and just pace around your house if that's the only comfortable thing you can find. So I don't know. Just a thought maybe for some of those patients where I think it's just,
Yeah,
they're so intense, that's why they can't come in.
I think that's probably one issue. I think there's probably more. And some people too have to catch public transport, and that's an even bigger obstacle.
Oh yeah, yes,
Yeah.
yes.
And then you've got to get back afterwards, and you've sort of, it's huge. Mm.
Yeah.
How I started doing the online stuff was talking to I was at the Austrian, the European Pain School in Austria. God knows, 8 years, 10 years ago, I can't remember. And a German doctor there who lives in Australia. And I said to him, "How do you help the people, patients who live out in the bush, like the lot of days away from a hospital?" He said, "Oh, we do online, and I said, "Well, how's that work?" And he talked about Zoom or I don't know, just doing programs online, because I think we forget that some people around the planet, a hospital, isn't just a car ride away. It's it's a day away or something, And I always remember uh, listening to a guy at a British Pain Society conference up in I think that was in Glasgow, and a Canadian fella, and he was saying then that this hadn't been invented by then, but he used to have for people that well then it was sounding quite Captain Kirk. It was people phoned in. They had several telephone numbers, so if people had a problem, they would phone in and they had to press 1 if you wanted information about pacing, 2 if you wanted information about exercise. I mean, you look back now and you're thinking, apply that's like so old school, I mean, but then back in the early 2000s, that was pretty Captain Kirk, I mean, think, wow, how neat is that? How fantastic is that? People can get access because, like Australia and Canada and America, if you're living miles away, especially in Canada and Australia, you're living not hours away, days away from a hospital.
Mm.
I know Keith that comes on here, and he has to go to a hospital. He has to get a flight, to see a doctor, So it's that the actual getting there, and I mean, it's that one thing, good thing, the only good thing about COVID was it pushed the health system onto using
100%.
online facilities. I mean, I
And the
used to think, like,
technology improved a lot too. Mm.
yeah, I mean, to me, going to see even me, I mean, when I used to go and see the doctor, the oncologist, it was only like 20-minute ride away, but it's the aggro of getting it because you can't bloody park in a hospital, and then you've got to queue up and da. Anyway, but they like COVID, it pushed them onto telephone appointments, and that's all I've ever had since. So
Mm.
That's part of the process I'm talking about, Pete and Mary, is right, is the simple act. Because if you call a clinic, just all of you randomly dial a healthcare clinic in America, they'll ask, when will you like to come in? Right. And so part of this process that I believe needs to change is, so Pete, right, where we set up a process. So Pete, what would work best for you? Boom, 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 right? And this, by the way, there was a study here in a very large area in Ohio, and they looked at people who would no-show or cancel for appointments. This was musculoskeletal pain, right? This was about 2 years ago, because I challenged I followed up with all the authors. I think I freaked them out, but because one of the reasons why people would cancel is they were more than 5 miles away. And I went, but would anybody ever ask why, right? And I'm going, there are probably people that had to take 2 or 3 buses, right? Maybe it's people with kids, right? To me, I'm going to say this, if we just ask, we've probably solved the 51% of the problem, right? And again, to all these examples, so we get to this. So Pete, what would work best for you? Would you like to come into the clinic? Would you like to do a visit over the computer? Or would you like to do a telephone call? Oh, I did. And we all know 90% of the time you'd get, oh, I didn't know I had those options. Right. So in my world is we can't leave anything to guess. Right. In America, everybody's pushing you to the clinic. And then that person no shows and and then you blame them. But nobody asked them, right? Oh, I had to take an extra hour off from work. Oh, I have to drop my kids at daycare. Oh, I don't have a car. Oh, I don't have a computer, right? And these are some of the things that I believe, again, further upstream could start to solve these problems without us overcomplicating, meaning people in the system complicating it. And back to, you're both right. This only happened, what, 3-4 years ago because they were forced to.
Hmm.
And they saw it worked.
Hmm. Hey, Grainne.
Hiya, sorry, got delayed.
We're talking about just talking about this. I put this on social media last week because last week was pretty much unprecedented the amount of emails I was getting from people around the world. Like, in the end, I had over 300, and
Oh, wow.
By Thursday, I come up with a short list really of these are the common things that people had concerns about, like So we just we're sort of thinking of have we moved on, like because this this is a list that well to me I'm not shocked by it because I'm shocked about the amount of people, but I'm shocked at that. These are the same things I could have been asked years ago, like,
Yeah.
and even myself experienced years ago, so.
I think you're right. I mean, I don't see sadly, any real changes in the questions that we're getting, having just gone back to working in a pain clinic, having not been doing it for 18 months. And to see just that there's just no, almost in some ways, some slight backwards steps, but it's quite, it's a little bit disheartening. That that we just seem to keep getting cycled in these models. And I had a psychology graduate sitting in with me today, and when I mentioned the Pain Toolkit website, which I always do to patients, and talked about the importance of them getting back in the driving seat and things that they would be able to do to to help themselves and how important those sort of things are. She was like, wow, this is really amazing. I've never heard of this before. Just like, how have you not come across this, being in this environment, working in psychology and everything else? How are people still finding that so new and startling? It's unbelievable, really. But there you go.
Yeah, I know it's an old record of mine. It's an old drum, but to me, all roads lead back to the med schools. Like, if they're only going to be teaching, anchoring in people into the medical model of care, then that's all they can really talk about, and until they change, really, I think people, way beyond my lifetime, Seb, you youngsters, mate. Grainne and Dave, you're going to be reading, and you, Jerry, you're all going
I
to
like
be
very much the fact that you're calling me a youngster. That's
and Mary,
my
I forgot
Friday.
Mary.
That's very generous of you.
I find it a worry because I think we've gone backwards. I mean, we used to have a lot of the self-management courses being run in the community, and we don't seem to have them now. So
No.
we have pain clinics in public hospitals that do them and do them very well. But it bothers me that we don't have them in the community like we used to. And that's a step backwards.
Yeah. Why is it not the first, as part of that, introduction to a service, where, we talk about all the time, that's your pet peeve, Jerry, that whole thing of the introduction to a service, the first person they meet, but as the very first interaction they have should be that positivity of, whatever else happens in this clinic, whatever else you might need, whatever things we might be able to support you with, the most important thing you can do is the stuff that you can do to help yourself. it just seems crazy that that's not sort of being put front and center as the primary message of the sort of simple, like we say, simple, but just, basic, sensible, practical, pragmatic. We've lost all pragmatism.
In the States.
Grainne, can I ask you a question,
Yeah.
Grainne? I sent you the reply. Let me just fill the rest of the guys in. Over the summer, there's a piece of information come out from the Department of Health and NHS England about, and there was a piece in it. I think you actually alerted me to it.
Yeah.
Where it was they're now called integrated care boards.
Yeah.
And there was a bit in their paperwork. It said that integrated care boards should be promoting self-management. Am I right? Have I got that right?
That's the goal of NHS England and
Yeah.
MSK framework.
So what I did, I actually wrote to all of the integrated care boards. I think there's 42 of them. I sent you the emails that I had back. I mean, it was really, it was just like a lot of the information I got back was a lot of what I call flannel.
Oh, there was so much word salad in there. I find it really hard
Yeah.
to discern anything meaningful from it. Almost felt like there was, I'm not saying that there was, but it almost had a bit of a feel of a chat GPT response in there. You've kind of, tell me what would be good about getting people to self-manage, and you get then your little paragraph comes up and says, this is what we try and do. And it's like, there's nothing about what you'd ask the question of, what do you do to promote self-management within your areas? And I didn't feel that any of them actually really answered the question of kind of, this is what we do, this is what our service offers, this is where we try and get things. It's kind of like, oh yeah, well, our goal is this, and all sorts of other things.
In the question to them, I asked them. I even sent in the link, so it wasn't me making up the statement. It was from the NHS England, and this the bit that makes me laugh. The lady come back. She said, "We are not allowed to open up outside links." And I said, "But it's from NHS England." She said, "Well, we So I had to then. She said, if you open a link and cut and paste what you want to send me, then we can act on it." So I had to, go on the link, cut and paste, then send them what NHS England had written. They didn't want to open up. They said they didn't want to open up the link. How about that? So it was just waffle. I didn't really get any sense of this is, we're being proactive. It was just waffle, and this is the bit I think it's are there the right people in place to actually advocate healthcare in general, really, and I'm not sure there are, as I think perhaps it's just they're good at working within certain sectors, but have they got the knowledge and skills to actually move healthcare forward? I know the NHS carries out the instructions from the Department of Health, but do the people at the Department of Health actually understand what the work we are doing, and what they're not doing is what the extra problems they're causing everyone, from not being proactive.
I do think that there's not enough people. We've talked about this before, you and I, Pete. There's not really enough people out there with education or coaching qualifications, actual, understanding how to communicate and coach and educate or help people to understand. There's lots of clinicians out there and lots of really good clinicians, and then there's lots of people who want service to do things. But in terms of right, how having somebody in their organization who's a really effective communicator or educator, has got a background um, in teaching, or in, in some of those sort of
Mm.
qualifications, as well as the clinical skills. I don't think there's enough of those sort of people. I don't know if there's more of them elsewhere around the globe, or whether we're just particularly lacking in that in the UK. But it feels like an awful lot of people think they're really, perhaps really good educators, but when you drill down into it, they don't actually
How do we
have
change it? That's the thing. Or
skills.
how could we be better influencers? You got these dudes on TikTok and all the other social media platforms where they call them influencers,
All the
How do
people who
we
get up at four
influence?
o'clock in the morning, and by 4:20 they've read 3 books, and then by 4:30 they've done their workout, and then by 4:45 they've done something else. Yeah, that's definitely not me.
The thing is, what's the answer? Is there an answer? Is there an answer to this problem? Or is this it? This is what we have to put up with and suck it up.
I mean, I think like, you know, I think there are a few things. Like one of them is like, definitely in med schools, like just not learning more about pain, but even just some basic stuff on like education. But even like other like MSK providers too, like physios and chiros, like I myself being a chiro, like there's a lot of people that come to like a lot of people go to the GPs first, but a lot of people come to us first. And
Mm.
I can't say if it wasn't for me going outside and like beyond the curriculum of my school and stuff like that, I would be in this spot or have the viewpoint I have, or try and teach the patients the way I teach them. So I think physios and chiros too have to learn more about this way of doing things, and how to educate. And it might not be like as good as a full teaching degree or anything like that, but even just like, Pete, the things that you do, like that's how we met, right? We had that workshop together, and um it was just I mean, I was really lucky. I had you one-on-one, but it was a discussion of like, okay, to this new, young Cairo, and I'm like, all right, man, I want to do this, but I don't know how the heck how. Just tell me how. And you gave me all the guidance, and it was awesome, and it's still stuff I use every day. So even if we just get more people do, and you taught me all that in the course of several hours, right? So I think there's a lot that can be done with, like, there's a little bit of effort for that can actually go a long way, like for how much I got out of what we did together. I'm like, yeah, I'm definitely hopeful that if the right things were done, we could make a difference. I genuinely do feel that way.
I think what we've done with
Yeah, like,
Dave's been working on it with the academy and stuff like that, where we can, and Grainne was involved in it with us, put some stuff in it, doing the coaching sort of side of it, making healthcare professionals better coach, perhaps making it into a coach, better information, self-management information. We try to cover, not tick a box, but fill that gap.
yeah,
But it's how do we? It's like, see, I keep coming back to Jerry all the time. Is that the front desk? Who's the people at the front desk who are coming up with um, the instructions for everybody else, sort of thing? It's that who the decision makers, sort of thing, like, how is that, even the decision makers, to me, they're part of the front desk. And if they're making crap decisions, then or coming up with poor decisions, not, then it's just trickling down, because the always told, like, the Department of Health make come up with the ideas, and it's the job of the NHS to deliver it. That's all they're doing is following orders. But how do we, I mean, was it like the other week? Yeah, last week I sent off. Because we've got this big review coming up with our NHS. You can have your say on how you do things, and I thought, well, well, it reminds me I've got to do that. But I drafted up two letters. One to the minister who's in charge of the the Department of Health West Streeting, and giving him sort of telling him about supportive pain self-management and the academy and whatnot, and the CMO of the NHS. Like, I don't think I'm going to get, or I know I won't get a reply back from them, but what I was hoping to was to grab someone's attention there, like, to get some sort of response. Hopefully I will get a response. I'll send them a copy of the pain toolkit, and because all we really want to do is not, it's not, we're not, I don't, it's not about us building castles, but it's just us helping them to become better decision makers, like, they can be better informed.
I mean, if you're getting, I know maybe 300 in a week was a big, unusual, heavy week, but even I'm going to have to show off my math skills here. Even if you're getting 100 a week, that's 5,000 emails a year, is it? Yes, good. My maths isn't that far off. That's a lot of people reaching out to get, this sort of information. And, they're not asking groundbreaking questions. They're asking things that their fears are there. There should be people in good positions in their healthcare services that they can speak to in their GP practices or their healthcare providers, physios, chiropractors, whoever they're seeing, that can talk to them about that, So either they're not talking to, either they are talking to them about it, but they're not hearing it for whatever reason. So it's how the message is being sent across, or they're not feeling able to talk about it in the consultation because it's not, the questions aren't being asked of them. But I mean, that's a lot of people reaching out with, really basic questions that aren't getting, that certainly aren't getting good, quick answers, but there's still positive things. I within what I've done this week and the 2 days that I've worked, I saw 3 people who had already themselves, before they'd even gotten to me, taken some proactive steps themselves to kind of think, right, well, I could do this differently, or I could do that differently. And that was really nice to be able to say to them, you're doing a brilliant job. You've really, you've really nailed that. Let's, help you tweak some other things. But, that's a really good start that you've made. So, as we know, people have the capacity to do so much. We just keep holding them back and keep them stuck in the kind of, well, you've got to wait to do anything until you're on the waiting list to go and see the pain clinic. You've got to wait until you go and see them. Why? Why can't they be, doing something positive in the interim? And the people that kind of not fully ignore that advice, but kind of just go, oh, I'm going to do something, they will get on and do something. But a lot of people out there who, for many other reasons, just don't have that fortitude or resilience at this moment in time to take those steps. So they keep getting stuck in that loop.
When I was at the early part of the evening, late afternoon, early evening, I can't remember the time. But it reminded me the email starts off, my doctor or my healthcare professional, my nurse told me to contact you. And I felt like I've become not me, but the pain toolkit has become like a dumping ground, like, I mean, because they haven't got the knowledge or the time or skills or whatever to to support patients, which is totally bonkers, like, I mean, not just me. I'm guessing other organisations, similar organisations, must get similar emails. But hey, see, Jerry, you got your hand up there.
Yeah, that's a rare day. I'm going to go back to what Mary was saying. I think when Grainne came on, is there seemed to be more support out there previous, right? Mary, you were saying in the community, there seemed to be more support out there.
Yeah.
So that there could be this, right? There could be this continuation. I see it again. If all of you called my clinic today, my responsibility to you is all of you are on a journey. This is the way I look at it. All of you are on a journey, and I need to find out where you are today on that journey and why you chose to connect with me, right? And then from that moment, find the next step for you. And I was saying earlier, Grainne, I think to echo what you said, is then it's my responsibility to make sure you take the next step and not leave you even until you've moved on to the next step and the next step and whatever. If that next step is the last step, but I called it the Sherpa mentality. And Mary had brought up that, a lot of this was a lot. Sorry. She said there were programs available out there. They seem to have diminished. And my brain started going about why have these programs diminished? Because of people out there that I could then move one or two of you into this in your community, could move you into this program, which could, right? Don't have to go see the doctor, don't have to do something else, but could possibly start with this community program. But now they're not even out there. So I just wanted to throw that back up there.
Yeah.
We don't have so many here. I'm not sure about other countries. I'm not sure, Pete, what you have over there. Do you still have those
Well,
chronic
no, because we
conditions
used to have
self-management?
the expert patient program, which was an
Yes, exactly.
incredible initiative and
Where to go?
variations on it. But it's funding, isn't it? They just went, I think a lot of it was funding, if my memory serves me correctly. The organizations don't necessarily want to reimburse people for the time and effort you put in. And actually it becomes, if you're the people running it on a community basis, you need some support, don't you? Because you're not, you can't just be that, not a dumping ground, but you can't just be that kind of thing. Everybody needs to go there so that, we're not seeing you in clinic. It needs to be sort of supported by healthcare professionals. And it felt like that support ran out from NHS England, and I don't know why, really. Pete might know better.
Yeah, I know why. We had we were sort of funded, I guess, by the Department of Health, and then they wanted to sort of let us be able to go and do our own thing, like and they sort of put us into something called a community interest company. So where we had to not be our own business, but we had to be look manage ourselves, sort of thing, But unfortunately, the people that they put in place for that to happen were people that were pretty clueless, if I have to be honest. And of course, they just squandered the money. I think the Department of Health give them about 30 odd million. It was, and that was, so it's like it's like me get the equivalent for me giving, Jerry, me giving your organisation, right? We've paid for your setup, right? So we've trained all these dudes up, the front desk dudes, all trained up to do their stuff and all that. And now we fund you to do all that. You're all up and running, and now we're going to give you 30, let's say $35 million. So you can carry on running it. And we've got these guys kind of come in now and help you do that. But the people who come in to help you do that wanted to go in another direction. And so
I apologize, Pete. I've got to jump off. I'm sorry.
Yeah, no worries, man.
I've got to
Take care.
jump off. I
Thanks for
appreciate
coming
this.
on.
Yes,
Take
thank
care.
you. And I'll be on the next one too.
Oh, I
So
do.
I apologize.
Yeah,
Thank
no
you
worries.
all.
Take care, man.
See you,
Yeah,
Jerry.
so they wanted to go in another direction, and so they didn't want to use the Stanford program because they didn't want to pay the license fee. So they wanted to, they wanted to come up their own self-management program, and anyway, long story short, it was just we just running out of steam, it was just the wrong people running the organisation, simple as that, as usual. So that's my opinion on it. And they wanted me to stick around to be part of it, and I said no, I'm out of here. I couldn't be party to the circus, like, you know, bit like what's going on in the political arena.
Mm.
I won't mention who. But
Yeah, I think, yeah. But do you know what? We have to just stay. We do have to stay positive. We do have to say that there are good things out there, and that
mm,
we can still make a difference. And each person that you make a difference with, whether it's one person a week or one person a day or one person a month, it makes a difference to their lives, doesn't it? And that's the key thing, starting them on a self-management journey.
mm,
And you know what? We might have even more little things that we can sort of celebrate, because that thing that we were talking about, Pete, looking at sort of at what we can do while people are waiting to get into a pain clinic. Is there anything we can do?
Mm.
The people at our local pain service definitely have an interest in exploring that with us. So that's a conversation that we
mm,
can definitely be
mm,
having. So there's still some desires there. I think the difficulty is getting something that works on a global level, or even not even a global level, but on a countrywide level. You can change individual hearts and minds and different sort of local areas, but getting that consistent agreement across the board of this is the sort of good advice to give people just seems to be very hard to get anybody to agree to.
well, I think it's bring us on to this last thing on here, the pain. You know, we're doing the third pain self-management conference in February, on the 8th of February. And I was talking to Keith the other week, and we thought it a great idea. Why don't we have, hey, why don't we have a pain self-management week, you know? And so so we come up with this idea, and on the website, I could, Seb, I don't know if you've seen this, but I can send you the link over. But it's so from the 3rd to the 8th. So we finish it off at the conference, but from the Monday through to the Friday or Saturday. Yeah, it was our Saturday, but in North America it'll be the Saturday.
Right.
That people, not us, but people like, yeah, you guys out there, you do something during that week, some sort of event, or even if you just tweet a little bit more or something. Not tweet, I mean, tweet X is gone now anyway. I moved on. Oh, coming off of Twitter, I'm going on to Blue Sky and Threads and
I've moved there.
Instagram and stuff. I can't support that plank. Nothing personal.
Mm.
So, but I'll send out the link to everybody. But if we can get our heads around what can we do during that week, how can we be influencers? How can we make a difference? How can we start sowing seeds with people? That self-management doesn't have to be expensive, you know. But just get people more interested in it as such, like, So they're the sort of things. I think would be useful for us to have a chat about, perhaps in the last few minutes that we've got here. I mean, Seb, are you aware of this week? Are you at all? Have you seen this? What I've been posting?
No, I haven't. No. Um, yeah, I've spent pretty minimal time on Instagram lately, but no, I'm definitely interested.
Yeah.
I'd love, yeah, that sounds awesome. And I'm thinking like, yeah, what you said, like, I don't know, the first thing that comes to my mind, just in regards to like, convincing people that it's really not, not that expensive. Um, I think obviously there's like I have some patients and it's just like I just say like they just get it, right? They're just like, oh, that's really smart, nice. And they just like run away with it. And those, right, those are and then you have patients and they need a lot of support, right? Um and I think and and I think with those patients, like a lot of those patients have been seeing, let's say they've seen someone like a physio or a chiro for passive care once a month because they say they can only afford once a month, and that session costs $90, and then over 12 months, that's
Mm.
I'm not going to do the math because yeah, I'll just pretend I didn't throw out any numbers. but I didn't go to school for math. I'll just leave it at that. But you know, like getting a self-management coach for like an hour every second month or half an hour every second month, like just you know, it's those graphs sometimes I wonder where they just show the differences and you know, one is this amount of time for the forever, the foreseeable future, and then one is like, you know, yes, it is an upfront cost, but and the reason I mean I think this should be covered by this should be a public healthcare thing, but I just know that's not gonna it's
Mm,
not gonna happen.
mm,
At least not anytime soon. So I think something because people are very I think hesitant to and I understand it. Money's tight for a lot of people. It's harder to spend money on something that you're not going to see a very immediate large reward with, right? Like
Mm.
for as a chiro, right? People say, I'll pay you this much money, crack my back, I'll feel better for a few days. Sure, you'll feel better for a few days, but right, that's it.
Mm.
Whereas it's harder to say, um, $60, let's have a conversation about what you can do for yourself in the next month. There's not as fun, right?
yeah.
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 It's different. I'd really like to, I don't know if we can fit it in as part of this week, Peter, whether we just do it as a separate thing. But from what you were saying there, Seb, about how that workshop with Pete really changed your practice and really helped you to understand how to relate to patients in a different way, I'd really like to do like a short Q&A with you, whether we do it as a recorded thing through the PN Toolkit to kind of say, you know, this is how you find it, and you know how because that might if we can make that available, that might then help other healthcare professionals to see, oh, you know, this is how it could, you know, this is how it could help someone to change. I don't know if you'd be up for that as part of that week.
We could do, yeah, we could definitely